Well, welcome everybody. I'm here with Andrea Skolkin. She is the Chief Executive Officer for One World Community Health Centers, Inc. Andrea, thank you for joining me today.
Thank you for having me.
There are so many things going on in the world, in our nation, and really in our communities as well. And One World, what your organization does, it helps so many people on so many different levels and so many different areas. So I'm just going to ask you straight out, One World Health Centers in a nutshell, just kind of give us the overview.
One World provides healthcare, medical, dental, behavioral health, and pharmacy services to the community, but we target our services to people who we call underserved. So that means it's affordable healthcare and easier access for low-income minority populations or people who don't have automobiles, that kind of thing.
Yeah.
And this is our 50th year in providing good quality healthcare.
Yeah. So yeah, this is a big milestone for you, the 50th anniversary for the organization. And I mean, can you speak to kind of like what things obviously have changed over the last 50 years significantly, especially, I think in what people need and how many people you are serving, because it's a big population. And can you talk a little bit about maybe how the needs have changed over the years?
I would say the needs haven't really changed.
Okay.
How we provide care has.
Okay.
And we started very grassroots volunteer in the basement of a church. Today we're fully modern, high technology, but we retain that high touch and we provide the best quality care just like any other health system in the community. We have that available here at One World. And over time, there's a lot more technology, but the skills of our clinicians are the basic skills that they're taught in medical or dental school, pharmacy, and they use them every day, just higher tech.
Yep. Yeah. And let's just talk a little bit about COVID-19, because I know everybody's been impacted. So in regards to One World, has anything changed, or what have you seen, or how have you had to like pivot, or talk a little bit about that?
We've had huge change at One World. Since the beginning of March, we had to turn on a dime, as they say, and we had to protect ourselves, protect our patients, and protect the communities that we serve. So that terminology is called PPE, and we had to acquire everything and continue to acquire it and protect everyone. Additionally, we began in telehealth. We had been doing telehealth in behavioral or mental health, but not in primary care, and that was a huge change and a change for patients, let alone the providers that provide it. We changed how our pharmacy operates to deliver medications, to have a walk-up window. There's just been a huge number of changes that we've had to implement in a very, very short window. So I could go on with a multitude of changes.
Sure.
But in summary, I would say, just to make things more accessible, the use of telehealth and some innovative things in our pharmacy and also in dental care as well, some high-tech UV machines that burn up the virus so that we can care for you without worry.
Well, I know you've got this 50th anniversary event coming up, which I want to talk about that. But before we get into this, I usually ask this at the very end of the conversation, but I'm going to ask you it now. So people in the community, you need help, and with the event coming up, that's how you get donations, and people are able to contribute back to you. But how can people contribute to One World and really donate, like at this particular time? What can people do to support you?
You can do just about anything. You can go to our website for our annual dinner, which is November 5th. It's virtual, like all events these
Yep.
days, and register and make a donation or buy a ticket and watch our history, which is being done in a very unique way using sand art and storytelling, as well as we have COVID awardees, organizations, or people that really helped us this year in providing care during
Right.
COVID. There are other ways too, though during this time period, our volunteerism, we've kind of slowed down,
Yeah.
but that is another way as things begin to open up. We have a food pantry on site and we're always looking for that. We have a baby boutique on site for our prenatal moms. We have a large population of women that we care for and babies, and they need lots of things. So it doesn't have to be money. It can be diapers. It can be onesies. Those kinds of things are very important. We often have families that maybe need shoes and socks or need coats. That's another way that we help families. And in our literacy center, we need people to help us when COVID slows down, help us with reading and English
Right.
language skills. So there's just a myriad of opportunities.
Yeah, there's so many. I mean, there again, you reach such a vast population that needs help, and gosh, your organization provides so much. So let's talk about the event, because I've got my invitation here that I
Oh,
want.
good. I'm glad you got one.
Yeah, I got the invitation, and I got it several weeks ago. But let's I want to dive in a little deeper to the event. Like you said, it is a virtual event. Like so many nonprofits right now are going virtual, and this is a big milestone. It's the 50th anniversary, and as I'm reading through it, you talked about sand story, and so you got the featured speaker, which once you're on the virtual, you're going to be talking to this gentleman, Joe is it Costello? Castillo. Okay.
Yes.
World-renowned artist and America's Got Talent finalist. So tell us a little bit about him, because he's a pretty amazing guy.
He is really amazing. I happened to be, I don't know if it was a year or 2 years ago, I saw him on the show and I thought he should have won. Hands down, it was amazing. He told his story. It's through art and it gets projected through the sand, and he is just amazing. So I searched him out, I found him, and was able to have him now virtually do his work. And then we actually had to write our history. We had bits and pieces, but we didn't have it all together. So the 50th anniversary, gave us a chance to kind of talk about our beginning, our middle, and where we are, and then be able to tell that story as well. Though we're not doing it at the dinner, we committed an oral history, or made an oral history, so One World has it forever. And so it'll be very interesting, and it's just amazing to watch. Unless you've ever seen it, you cannot believe what he does.
Yeah, well, I'm actually excited. I'm going to get my ticket. It's Thursday, November 5th. There is a silent auction that people can bid on. Is a silent auction up ahead of time, or is it just during the evening?
We're going to open the silent auction a week before, and then it's going to continue. They'll be shut off while he performs, and then be open until 9 o'clock. And the program is an hour. It's only an hour, 7 to 8 p.m. And the silent auction is open prior to that.
Yeah. Well, again, so many things going on and so many, challenges, so to speak, but the need, it doesn't go away. I mean, at all. And
It's amazing that you say that, because I have philanthropists that say, when is it enough? And I said, it's not enough until
yeah,
everyone gets what they need. And unfortunately, there's actually more need now, but the need, even pre-COVID, was bigger than people realize, in neighborhoods that people don't realize, where
yeah,
people are struggling.
yeah.
Mhm.
So again, people can't, I mean, your website, I was looking, I mean, I've been on your website,
Mhm.
was looking at it to just before we, started chatting, lots of information on there for people to find out more about who you are, how to donate, how to give back. But one way is to attend the 50th anniversary
Mhm.
gala that is virtual this year.
Yes, and it was all like planning a whole new event. It will be fun. It's mostly virtual. There is a little live portion of it, and we'll hope to see everyone there.
Yeah. Well, Andrea, thank you so much for joining me today. And we'll definitely connect after the new year and kind of see where things are at with One World Community Health Centers, and see, how else we can help your
Thank
organization.
you. We
So,
appreciate the time, and come and watch us and learn about us.
yep,
Yeah.
absolutely. All right. Thank you
Thank
again.
you. All right. Thank you.
Okay. Bye.
Bye-bye.